very important topic on the show today, and that is mental health awareness. And today, specifically talking about mental health awareness in men, we are talking to consultant psychiatrist Dr. Amir Javaid, all about men and their mental health. First up, I want to talk about mental health as a concept, or psychology as a concept, because I feel like it's not taken as seriously as breaking a leg or other kinds of injuries. Why is it? Is it because we can't see it?
Absolutely. I think this is a very important question which you have asked. When we always hear the word mental health, we always think about mental illnesses such as depression, anxiety, or stress. But mental health is beyond that illnesses. It's about our all emotional well-being, our ability to cope with the stresses, our ability to make or build relationships, and to manage our emotions. And still in this day and age, there's a lot of stigma around
because nobody wants to admit that they have depression. Nobody wants to admit they have anxiety.
Absolutely. That's the only thing, because they are feeling that they have been labeled of mental health issues or problems. So there need to be a lot to be done in this especially area to create awareness among the people to take it more seriously. And it is equally important in males and in females as well, because I always say that mental health don't discriminate by genders.
There are some statistics when it comes to mental health awareness, especially when it comes to men. More men show aggression, show loneliness, and higher suicide rates, I believe 86%. Why do you think men are disproportionately affected by mental health issues?
I think that's again very important question. According to the statistics, 1 in 5 men worldwide, they will experience mental health issues in their lifetime, and they are more likely to commit suicide about 3 to 4 times as compared to the women. And the reason being is the stigma and our traditional masculinity norms. That is probably preventing them to admit that they have any issues. Men are taught, unfortunately, to equate strength with silence, resilience with isolation, to control emotional by having a masculinity power. So I think
boys don't cry.
Boys don't cry, and man up, all these kind of stigma that is associated with this situation, unfortunately. So I think that's why they are more likely to diagnose at a later stage as compared to the females, because of not admitting to the fact that they have mental illness.
If somebody doesn't know where to start, they know that they don't feel good, maybe depression or anxious, who do they speak to? Because it's psychiatrists, psychologists, counselors, therapists. Where does somebody start to seek help?
So first step is definitely discussing with your friends, discussing with your family members, and then need to seek more appropriate specialist services. So I always say that to start with the primary care practitioners like GPs, family medicine specialists, and if they are certain that they have mental issues which are quite grave, then they can go to the psychiatrist directly for a full, thorough evaluation of their psychological problems or issues.
Well, there you have it. If you or anyone you know is struggling with their mental health, then there are avenues where you can seek help and make sure to help one another as well.